So we know that ibrutinib increases the risk of high blood pressure or hypertension. We also know that it's difficult to treat that hypertension, either de novo hypertension that starts after the start of ibrutinib, or even hypertension in patients who had a history of it and then started ibrutinib. So for the first time, we were able to collaborate with a number of centers in the US. And what we did, we looked at the trend of blood pressure, looking at different time points in relation to the type of anti-blood pressure medications that patients were taking. And of course, at many time points, they were taking more than one drug. So this was the first time that somebody was looking at the treatment pattern and trying to find out what is the most effective, either combination or a specific class of antihypertensive drugs. We found that you need more than one line of therapy, in many cases 3 or 4. And we also found a signal that a combination of certain antihypertensive classes could be effective. Hydrochlorothiazide seems to be an important part of that combination. And whether or not patients had a history of hypertension or not, other partners, we found that could be important as part of that combo. So, as a large multi-center retrospective study, we look at it as a signal finding study. The field of cardio-oncology is becoming more and more prominent, and we're really hoping that our colleagues use this data and maybe look for studies that try to intervene and find the best way of treating hypertension after ibrutinib. I would mention that majority of our patients were on ibrutinib, so we also need to look at the second and third generation BTK inhibitors. We don't know if hypertension is as complicated in patients who are taking those drugs. It seems that the hypertension seems to be a class side effect, but we also have randomized trials showing that drugs like acalabrutinib and specifically in the Elevate-RR study has a lower rate of hypertension. So we need dedicated studies looking at second generation BTKIs, but we're excited for the first time to report that certain combinations or classes of antihypertensive drugs may be more effective in patients who have hypertension while taking ibrutinib.